Good morning. This is Dr. Timothy Scott Peck giving you my daily update here from Life Point Medical. It is November the 18th of 2021 and life is good this morning. It's beautiful weather outside. Hope you're having a good day. If you're not, if you're sick, we want to hear from you. Okay, let's go ahead and real quick and talk about COVID. The colors on the map have really decreased. However, the numbers popped up again yesterday, 5 more cases. And unfortunately, 3 deaths attributed to COVID in this county were added overnight. So that's kind of disheartening. Okay, so it's still here. Let's just hold steady and try to weather the storm on this guy. And just be careful out there, okay? It is difficult sometimes for me to help people and to let them know what they need to get done. Contact us if you do have COVID and we'll help you, I promise you. And if you're still on the fence about the vaccine, which I don't think anybody is, you're either a yes or a no. If there's anybody out there who's wondering, go get it, okay? All right, so I'm gonna give you a little clinical pearl today. It's called talk about inguinal hernias. Okay, so abdominal hernias are outpouchings of your abdominal wall from weakness, and the most common form of hernia is inguinal hernias. And inguinal hernias are in your inguinal area, which is your lower abdomen on right at the top of your hips on the front side. Okay, and what you'll do is you'll feel a knot pop up, and the knot can be anywhere from the size of a silver dollar. Sometimes they can be bigger. It can be the size of an orange or even a grapefruit. Interestingly, the bigger the hernia, the less dangerous they are, in the sense that the problem with hernias is your gut is what's going into or sticking through the abdominal wall, and just every once in a while those things will get hung and it gets stuck there, and it's extremely painful, and it cuts off blood supply to your gut, which makes you at risk of having an issue, which is a surgical emergency. So anyway, if you ever wake up and you got a bulge and it's hurting, the first thing you do is you try to push it in. See if you can push it in, okay? And if you can push it in and the pain quits, you need to go see a doctor to get the diagnosis and get set up for surgery. If you can't push it in and it's hurting, you need to go to the emergency room, okay? Because that means you're stuck. You've got an estrangulated hernia, and you need immediate medical care if that's the case. And that's the real crux of it. We watch hernias more than we used to. We don't always fix them, okay? But if they're affecting your lifestyle, or they're hurting, or of course if they're estrangulated or in there and they need to be reduced rapidly, then that's a surgical emergency. Okay, so if you think you got a hernia or you're worried about a hernia, come see us here at the office and we'll take a look at it and diagnose it and get you to the right treatment. Otherwise, life is good. I got a good update yesterday from Place of Hope, and the outreach that we are performing proactively is impressive. It's actually exactly what I wished I could be a part of, which is where we're just not sitting there waiting for things to happen to kids. We're out there trying to hunt these kids and do the best we can for them, and try to make sure they know they're loved. And that's a beautiful thing. I love it. All right, otherwise, you guys have a great day. I appreciate you listening to me. And if you have any problems or anything, give us a call. We're set up to take care of you and get you taken care of. Have a wonderful day. Thank you.